During my undergrad degree, I was taking a broad range of courses, from geology to economics, but what spoke to me most powerfully was medicine. A holistic approach to medicine is one that considers the patient as a whole, mind and body. Utilizing this method is the only way to address the physical and psychological challenges a patient is dealing with. This is incredibly important, as addressing health challenges in a multidimensional way increases the likelihood that the patient will experience sustainable health improvements. For example, if a patient is dealing with obesity and the doctor only prescribes weight management pills, they have neglected to consider other physical and psychological effects the condition can have, such as increased anxiety, possible depression, even joint pain. It's imperative that doctors take the time to investigate how various symptoms may be related and develop treatment plans that target the root cause of as many symptoms as possible. 5 years ago, a female patient of mine approached me and asked about cannabinoid-based therapy. She asked if she could get a prescription for CBD. She was 86 years old, had arthritis, and required the use of a walker. At the time, my medical training against cannabis and any related compound was incredibly strong. I immediately had a judgment about this woman that I had been treating for all these years. All she asked for was a prescription for CBD, and I emphatically said no. I told her it was marijuana, that it could not be used as a real medical substance, and that there was no evidence supporting its use in medicine. She ended up going behind my back, getting another doctor to prescribe it for her. A few months later, she came to see me and said, "Look at me. Look at how much better I am." And she was. Her pain and inflammation were significantly decreased, and her mobility had significantly improved. That was an incredibly humbling experience, and a very important experience because it revealed that I was so immersed in my own paradigm and the constraints of my training that I had ignored a viable treatment option for my patient. Thanks to the modern world, through the internet, she had taken control of her health and had taught me a lesson. It was after this experience that I began utilizing CBD for my own rheumatoid arthritis. And I'm continuously amazed by my own results and those of my patients. Medical treatment should not be treated like a one-size-fits-all program or take a pill daily and be magically cured scheme. It's, however, a journey that requires time, patience, and consistent practice. I strongly believe that physicians should concern themselves with as many aspects as possible that influence the health and well-being of their patients. This may include things such as their career, family life, social, emotional, physical health. This is not to say that doctors need to make judgment calls on your personal life. I'm saying it's important for your doctor to understand the level of stress you're under, as stress impacts your overall health. Caring for a patient takes time, and as a physician, the best treatment involves my functioning as a guide as well as an educator. This way, not only am I able to care for the patient's immediate needs, but I can also provide them with the tools to sustain and improve their health long after their time at the clinic has passed. Thanks for watching. I hope you learned a bit about who I am and what I stand for when it comes to holistic medical practice.